Every day, our shoulders, they do much of the heavy lifting, like reaching, carrying, throwing, and yes, even hugging. But what happens when these important joints stop working the way that they're supposed to, or even worse, that they begin to cause pain? Well, today we will talk about everything from the causes of shoulder pain and types of injuries to treatment options and preventative care. Dr. Matthew Motisi, an orthopedic surgeon with Baptist Health Orthopedic Care, is here to share his expert advice as well as answer your questions on this episode of Ask the Doc, No Appointment Needed.
Funding for this program is brought to you by Michael J. Zinner, MD.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.
Hi there, I'm Julie Donaldson, and welcome to Ask the Doc, No Appointment Needed. This is the show where we encourage our viewers to send in their health questions. We have our Dr. Motisi here with us. Doctor, we've got a lot of great questions, and a lot of them, of course, coming from athletes, but a lot of concerned family members as well. So excited to get feedback from you.
Happy to be here.
Okay, let's kick things right off. And we get a question from TJ on Facebook, and he says, hi, Dr. Motisi. I am a wide receiver on my college football team, and I don't have any shoulder issues at the moment, but I am thinking of the future, and I'd like to know what are the most common causes of shoulder pain in adults. Dr. Motisi, this really is kind of the perfect way to kick the show off with.
Yeah, I mean, as we get older, there's multiple pathologies that can occur in the shoulder. Most commonly, we always deal with rotator cuff issues, and that can happen at a younger age, but more often it's later in life. Other issues that we run into is arthritis, and that too can be earlier in life as well, depending on if patients have had any injuries, especially during their younger years playing football, if they've ever had shoulder dislocations, or if they've done heavy weightlifting or bench pressing. So these things can come about into their middle age or later years. So as far as rotator cuff and arthritis of the shoulder, best thing to do is make sure that you keep your shoulder healthy. Make sure you continue with your rotator cuff exercises. Make sure you have good form when you're weightlifting. And if you ever do experience pain that does not go away after several days, then definitely seek treatment rather than pushing through it.
So you mentioned already quite a few of these causes of shoulder pain. I know there's a little bit more on this list. Let's take a look at what the biggest causes and issues are that people run into. When you look at this, how can people maybe try to avoid some of these causes to not have to have a lot of shoulder pain or even worse injuries?
Yeah, and a lot of these go hand in hand. The wear and tear, the arthritis, essentially the same thing. The tendonitis and bursitis and rotator cuff tear, that's on the same spectrum of rotator cuff pathology as we age. Your rotator cuff gets weak and then it starts to move around more when your strong deltoid or pec or latissimus dorsi start to pull on the shoulder. And eventually you start getting, impingement and tears of the rotator cuff. Also, as we age, the vascularity to the rotator cuff starts to diminish, and that also causes micro tears that lead into larger tears. So for these 5 issues, once again, the best things to do is keep your rotator cuff strong, keep the muscles that attach to your shoulder blade strong, keep your core strong. And when you work out, if you're performing appropriate technique, when you're lifting weights and as long as you're warming up appropriately before and after your activities, you can minimize your risk of these 5 issues.
I do like that TJ is thoroughly enjoying the moment as a wide receiver, but also being very cautious of the impact that could have on his long-term health. So again, we're off to a really great start. Our next question, this comes from Joey, who reached out on our YouTube page and asks, hey doc, my boy, Joe Jr., pitches for his college team and he's got an amazing curveball. The coach thinks that he has potential to make it to the pros, but his arm has been bothering him lately. And I'd like to know, how can you tell the difference between a tear tear in the rotator cuff and a muscle strain. Obviously, Dr. Motisi, pitchers, they go through a lot of shoulder issues. What would you have to say for dad here?
So for dad, if he's having issues, I would definitely recommend being evaluated and determining what the differential diagnosis could be. Is it the elbow? Is it the shoulder? Is it his mechanics? Has his velocity or control changed drastically recently? And then obviously, if it's warranted, then we obtain an MRI, and then we can further evaluate the soft tissues.
You know, Dad said that it's the curveball that the coach is really excited for. What pitch might be more dangerous for up and coming athletes? And is there a certain time that they might want to be able to try to introduce new pitches into, into their repertoire?
Yeah, by the time they're in college, all pitches are safe. The curveball can be more strenuous on parts of the elbow, and the shoulder, but more importantly is the velocity and the frequency they're throwing and how many pitches they're throwing. So making sure you maintain appropriate amount of volume when it comes to their how many pitches they're throwing. That's the most important thing, and as well as making sure that they keep their shoulder as healthy as possible.
Yeah, I guess if you start feeling that pain early, like speak up so you don't get burnt out and have bigger issues down the road. Because if that curveball is really good, you got a chance to make it to the pros, right?
Absolutely.
All right, Pillar reached out to us on our YouTube page, and her question is Buenos dias, Dr. Motisi. My father, Enrique, recently had surgery on his shoulder, and he's worked in construction for many years. I guess the wear and tear finally caught up with him. Anyway, I would like to know what is the best sleeping position for shoulder recovery? Doc, I never really thought too much about this, but I'm somebody who likes to sleep on my side, and I'd imagine if my shoulder's hurting, that could be a problem.
Yeah, that's a common question I get in the office is how do I sleep? And I always warn everybody before surgery, sleeping is very hard. Whether it's just an injury or they have an acute flare up, or if they've just had surgery, it hurts. I wish I had a great answer for everybody. The first thing I always recommend is sleeping in a reclined position can help. They do sell specialized pillows that kind of help elevate your shoulders off the bed, or if you sleep on your side, elevate your neck up and allow you to kind of take the pressure off your shoulder. But sleeping is very hard, and it's actually one of the main indications sometimes when for surgery when patients just aren't improving with non-operative treatment.
Okay, sounds like a challenge just to get the sleep and the recovery that is needed as well. So, we're already getting some great questions in. And if you missed the opportunity, here is how you can submit your questions.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.
Hey, Jeanette submitted our next question, and this is from our allhealthtv.com website. She says, Hello, doctor. I have twins, Philip and Felicia, and they both play sports in school. How can young athletes prevent wear and tear injuries like tendonitis and impingement? Doctor, I'm sure a lot of parents are concerned about this, as we've already talked about. You want your children to have success, but not at the risk of injury.
So in the younger athletes, especially if it's a throwing sport such as baseball, it's really the volume and making sure they take appropriate amounts of rest. You don't want to be throwing or pitching every day. You don't want to be throwing 100 pitches every day. So making sure that they take appropriate rest, that they find enjoyment in playing other sports or other positions. That's also important.
Mentioned other sports there's always this thought process of maybe you have to be one sport, but you sounds like you're thinking maybe having some variety at a very young age might be more beneficial health wise.
Yeah, it's a controversial topic because the trends are people playing one sport year round their whole life. There's not as much people aren't playing as many other sports as they used to. So it's a little controversial, but I do think cross training or learning different skills that you may not learn in one sport, I think it is beneficial.
Well, certain exercises maybe they can start having their young teens and young kids getting into to help prevent as well.
Uh, yeah, strength training is very important in my professional and personal opinion. I think that cross training or doing exercises that they may not be doing in their sport typically. I think that's very important. I do think playing other sports also teaches body movements that are different than what they're used to. So I do think all those things combined, I think, are important. And mainly, it just means do things that are different.
And what about this? Because I am terrible at this. I get yelled at it for all the time. A proper warm up. How important is that?
Oh, it's incredibly important. A proper warm up as well as a proper cool down. And then on your rest days, doing appropriate rest activities as well. So, the warm up, the cool down, and then also on your days where you're resting, to doing a warm up and cool down as well. That's all important part of recovery.
I'm taking notes. Got to be able to keep moving. Our next question comes from allhealthtv.com. You should really check out our site, really, folks, if you have not yet. It has a lot of great information there for you. Raja asks, Dr. Motisi, I am a weakened warrior who tries to spend as much time on the links as possible. Unfortunately, I've developed some pain in my left shoulder, and the doctor prescribed steroidal injections. Are these injections safe for chronic shoulder pain? I just love to get your opinion.
It depends on the diagnosis. For arthritis, I think it's perfectly appropriate. Usually, we do those inside of the joint, or what we call intra-articular injections. For bursitis, or if it's just chronic impingement and the rotator cuff is intact, I think a subacromial injection, which is an injection outside of the joint between the rotator cuff and the part of the shoulder blade called the acromion, I think that's appropriate as well. Uh, Personally, I try to hold off on injections and treat them more on second line treatments, meaning that my first line treatment is always going to be physical therapy, plus or minus a medication such as a steroid or a non-steroidal anti-inflammatory. And then injections are usually second line treatments. If you do have a rotator cuff tear, and I believe it to be repairable, I tend to try to avoid injections mainly because it can soften the tendon, or worse off, if we have to repair it, it can increase your chance of re-tear.
Can injections help maybe potentially prolong surgery?
Can injections help prolong
Yeah,
surgery?
delay having to need the need for a surgery.
Typically, injections may not delay, but if we can calm the inflammation down, and with physical therapy being the main portion of non-operative treatment, if your shoulder can compensate or improve its mechanics so it's not as painful, yeah, it can put off surgery because we change your mechanics. Surgery for the shoulder is usually indicated if there's a mechanical issue that's just not compensating well. People can live with rotator cuff tears or arthritis of the shoulder, and as long as they can compensate, then surgery is not necessarily recommended. But if they can't compensate, or their function declines, or there's a mechanical issue, typically we recommend surgery. So injections at that point, they don't really aren't going to change the mechanics.
Okay. Well, it's good to go make sure you see somebody to know where in your process of recovery and injury you are to get the right treatment. Our next question comes from YouTube, and it's from Ralphie. Hey, Doc. I play softball in a couple of men's leagues around town. My throwing shoulder began hurting a few weeks back, and my doctor said he thinks that I might have a tear in my rotator cuff. Tell me more about the rotator cuff, and can it be healed by physical therapy? Dr. Motisi?
So the rotator cuff are four muscles that turn into tendons and attach the ball portion of your shoulder joint. And your rotator cuff is mainly the tendons mainly center the head at the joint so that it doesn't move around. Unlike the hip joint, which is very contained, it's a ball and socket. The shoulder joint is also ball and socket. The only issue is the socket's very shallow. So it's a very naturally unstable joint. However, it also gives us how much motion we have in the shoulder. So the rotator cuff is really important for centering that head of the humerus, or centering the ball portion of the joint. And when we start to develop rotator cuff issues or rotator cuff tears, the micromotion or the instability that can occur causes pain. So if you feel like you might have a rotator cuff tear, then it's very important to kind of be evaluated, maybe even get an MRI to see the extent of it. And as far as treatment, physical therapy doesn't necessarily heal the rotator cuff, but it can strengthen the rotator cuff, or what you have left, or also the muscles around the shoulder, what we call periscapular muscles, or muscles that attach to the shoulder blade, as well as your core. And if you can strengthen all those muscles up, you don't necessarily heal, but you compensate. And most people can compensate very well.
You do have a rotator cuff tear and you kind of work through it through physical therapy. What do you need to be cautious of in the future that you don't tear it again?
Yeah. So there is a natural progression with rotator cuff tears once you have a full thickness one. There are sizes of tears that we have to be more cautious with, and we determine that based on an MRI. That's why, to me, an MRI is always important because it gives us a baseline on where you're at. And then we can make more accurate predictions on what the natural course of the rotator cuff tear would be. If it's a small tear, the risk of progression may be lower. If it's a larger tear, well, the risk of progression might be higher, or it can go on to what we call fatty atrophy or muscle atrophy that's irreversible. So it's good to know these things. And as far as, I'm sorry, the question once more was,
Just if you already have one tear and you go through rehab and you heal it, what is the risk of
yeah,
re-tearing it again? What precautions do you need to take so you don't do that?
yeah, and it's just keeping the rotator cuff that you have left strong, and listening to your body. If you start noticing increased pain that doesn't go away in a few days, if you notice a decrease in function that occurs and doesn't improve, that those you just have to seek treatment, and then allow us to evaluate you with a physical exam and possibly updating or obtaining an MRI.
Right. We've got a lot of questions that have come in already and so many more to get to. But if you have not submitted a question yet and you want to know how and where, well, here you go.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.
Hey, Doc, we're also getting a lot of great information from you already on how we can try to prevent and manage and take care of some of the injuries that we come across in life from use of our bodies. But Gentry now has another one. This comes from YouTube. It says, Dr. Motisi, I am the concerned mother of a nationally ranked collegiate tennis player who is currently going through rehab for his surgically repaired shoulder. Now, I think he's trying to do too much too quickly. My question for you is, what are the most common mistakes patients make during shoulder rehab? I would say, first off, to mom, congratulations, right? That's absolutely fantastic. Your child's doing so well. But as athletes, tell me how often you come across somebody wanting to kind of get back out there maybe quicker than they should.
I mean, athletes or no athletes, some patients just they do a lot too soon, and some patients don't do a lot at all. So, there's always a fine balance, and of course, after surgery or an injury, or we always have appropriate follow-up, so that way we can help guide them. Because everybody's a little individualized. Sometimes we have to speed people up, sometimes we have to slow people down, and that is very individualized, and so therefore, appropriate follow-up is important. For somebody that's doing maybe a little too much, I have to remind everybody that our surgeries are there to put things back in place, but ultimately the body has to heal. And if you don't allow the body to heal, and it will fail. So you have to kind of guide our patients to just either slow down and follow our specific protocols that we have, and we coordinate with the physical therapist a lot. So sometimes we'll get calls with concerns, and then we bring them in sooner, and we just it's a very dynamic process sometimes, especially with the high level athletes, because they are capable of a lot. So what's a little to them, or what's a little to them may be a lot to the average person. So we do have to kind of curtail our protocols based on the person, what their activity is, what their level of competition is, what their age is too.
Somebody kind of coming out of that surgery, is there a standard set time of recovery and healing before they can get back to their normal functions?
It depends on which procedure they have. Unfortunately for the shoulder, there's so many different problems that can occur, and different surgeries that can be performed. It's hard that none of them really some of them can have different protocols and expected outcomes of return to plays. So, it really just depends on what procedure was performed specifically. I would say in general, 3 months is usually the bulk of most recovery, where return to play for most issues is usually somewhere between 4 to 6 months.
A long time to have to sit out if you're top ranked, but if you don't, it's going to probably be worse, right? Okay, well, our next question comes from Maeve, who reached out via Facebook. Maeve wants to know, hi, Dr. Motisi. I'm studying to be a physician's assistant, hopefully with an orthopedic practice, and I'd like to know what some of the red flags are that shoulder pain might indicate something more serious, like an infection, cardiac issues, or even fractures. All right, doctor, this is a pretty big question.
Yeah, this is a whole lecture. Uh, I mean, mainly the biggest thing I would say is function. Look for somebody's function. If they were able to get their arm all the way up above their head with no issues the day before, and then today they can't even move their arm, that's a red flag to me. If patients are just having pain or pain with specific motion, well, then that's not such a red flag. But as far as a red flag in general, I would say if you look at their function and it drops drastically at an instant, that could be a fracture or could be an acute large rotator cuff tear. As far as infection and other medical issues like cardiac, I mean, those are difficult to determine. Usually, they're going to be associated with other symptoms. Like for a heart attack, you're gonna have shortness of breath or chest pain or dizziness or lightheadedness. For infection, you're gonna have a fever. You're gonna see redness and significant swelling. Um, but as far as like red flags for this, always think about function.
Our next question comes to us from Ivan, who reached out through our Instagram page. And Ivan asked, Dr. Motisi, I've been going to physical therapy for a car accident I had last month, but it doesn't seem to be helping that much. So I'm curious about new treatments and technologies that are emerging for shoulder injuries and recovery. This is a very important question, doctor.
So I would
Uh,
first make sure that you've had an appropriate evaluation and make sure you've had an MRI so you can know what to target. After that, there's a lot of different technologies and that have come out for treatment of the shoulder. Or arthroscopic minimally invasive procedures have always advanced. There are biologic injections that are available that potentially can help relieve pain or help with inflammation or healing. But more importantly, is knowing what your diagnosis is. So I would always start with an appropriate physical exam, X-rays, and possibly and most likely an MRI.
Great. Thank you, doctor. We also have this video from the Mayo Clinic that we want to bring to you.
Shoulder arthroplasty, or shoulder replacement surgery, is a complex procedure where damaged bone is replaced by metal and plastic implants. Computer software helps doctors create a surgical plan as to where those implants should be placed.
But we didn't have a way to easily translate that plan, which is very accurate, to the operating room.
That is until now. Dr. Joaquin Sanchez Sotelo is the division chair of shoulder and elbow surgery at Mayo Clinic. He recently performed the first ever mixed reality navigated shoulder replacement surgery. Specially designed tools and goggles create a highly accurate hologram of the joint, and together they
And allow us to place the component exactly where it belongs.
And that's important because
Placing the implant exactly where it belongs has a direct impact on complications, outcomes, and longevity.
Dr. Sanchez Sotelo has seen a lot of change over his career, but this may be the most exciting.
This technology is going to allow us to do things that were unthinkable before.
For the Mayo Clinic News Network, I'm Joel Streed.
There's a lot of new advancements and new treatments coming down the pipe there. Is there anything you would like to add to that?
Yeah, I would say the virtual reality augmentation is something that's new with our shoulder replacements, but more importantly is obtaining the CT scans that we put into our software programs where we can plan the component positioning perfectly. And then more importantly, what we'll be developing more in the future is going to be the robotics. Robotics have proven to be very useful tools in hip and knee replacements, and the shoulder will also most likely be the same. So from 3D planning with CT scans and the augmentation, and then advancing to the robotic procedure, that'll be the biggest advance in shoulder replacement surgery.
It's pretty amazing what technology is doing and how it is advancing things with your guidance, of course. We have a final question here. This comes from Raven from allhealthtv.com. Dr. Motisi, what role does posture play in long-term shoulder health?
Oh man, that's a great question. I mean, it's a significant portion. Your posture, as far as your spine is concerned, I mean, obviously, it'll change your thoracic, scapulothoracic motion. Your scapula protracts or retracts depending on how you sit and what your posture is like. So, your spinal posture as well as your scapular posture makes all the difference in the world. When we think of moving our shoulder up and down, it's not just the ball and socket joint, but it's also the shoulder blade that moves. So if your posture, whether it's the spine or where your scapular is in position, it plays a huge role. So that's why we talk about periscapular strengthening or strengthening of the muscles that attach to the scapula, as well as core conditioning, which contributes to your spinal alignment. So that's why it's so important.
You mentioned the core quite a few times and how important that is to our physical health, to our shoulders, to a lot of different things as well. And I think just sitting up straight, right, not slouching as we're sitting at our computers all day long, will go a long ways. Dr. Motisi, thank you so much for your expertise today and for everybody that sent in a question. But that is all the time we have for this episode of Ask the Doc. Thank you for watching, and we'll see you next time. No appointment needed.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.
Funding for this program was brought to you by Michael J. Zinner, MD,